everyone, and welcome to our Monday Minute. Today we're going to review the release of the OASIS-E1 Guidance Manual. We've been waiting for this release. It actually was released December 9th and then was re-released on December 16th. This OASIS-E1 Manual we hope now to be final. The OASIS-E1 will go into effect January 1st of 2025 with the new OASIS-E1 forms. The OASIS-E1, of course, had very few changes, but some that could be of significance, such as the discharge column, the discharge goals being removed from the GG items, a couple of items being completely removed from the OASIS that was not useful at all in any other calculation or outcome measure. It is extremely important that you do review the guidance manual for some updates to instructions on how to complete some of the items. There were some minor revisions to Chapter 1 of the OASIS Guidance Manual, including some examples that have been included for Medicaid certified pediatric agencies, information included about the all-payer OASIS requirement that we will review in just a minute, and a reminder that OASIS is not required for pediatric-only patients. Beginning January 1st of 2025, completing OASIS for all patients becomes voluntary. This is regardless of payer, which will be required beginning July 1st of 2025. The confusion that surrounds this is that agencies need to be very clear that who you complete an OASIS on has not changed except the payer situation. In other words, we do not complete OASIS on pediatric patients. We do not complete OASIS on maternity patients. We do not complete OASIS on patients who are receiving homemaker-only services. If the patient is receiving a skilled service if that patient were a traditional Medicare patient, we would do an OASIS. You must complete the OASIS regardless of who's paying the bill. If the patient is writing a check themselves, you do the OASIS. If it is a workers' comp patient, you do the OASIS. All these OASIS must be completed beginning with starts of care July 1st, 2025 and later, and all OASIS that would be under that patient's care plan after that new start of care. It is important to also understand that if the patient's already on service, you would not start or be required to complete OASIS until that patient had a new start of care. So, for example, if the patient were a private pay patient writing a check to pay their own bill and they were receiving skilled nursing services and they were already on service July 1st, and that patient discharges in August, you would not be required to do any OASIS on that patient. If that patient came back in September and had a new start of care, you would then be required to do OASIS from that point forward for any services you provide to that patient. Please do not wait until the required date of July 1st. It is very important that you begin this process early on in the voluntary window so that when you do get to July 1st, it will be just like clockwork for you. You do need to understand that your surveyors are going to be looking at this information and making sure that you are completing and transmitting OASIS for all patients with starts of care July 1st and later. If you need assistance with OASIS-E1 education at all, please don't hesitate to reach out to Healthcare Provider Solutions. We will be updating our 5-part OASIS-E series to now be OASIS-E1, and that will be released by the end of the year into January of 2025. delayed release because of the delay in the actual final manual being released. Please don't hesitate to reach out if you need assistance in any way. Have a fabulous week.